Hi, my name is Khalida. I'm one of the psychologists here at the Talbot Centre. In line with our theme this week, anxiety in youth, I wanted to talk just a little bit more about what it is that we should really look out for when we're trying to support somebody who we think might be experiencing anxiety. And also, when do we know about how to seek extra support for them? So seeking some support from a professional and when to really do that. So again, as we've been saying this week, recognizing anxiety in youth is super important because we want to make sure it does not interfere with their relationships, schooling, performance, and just their overall kind of ability to do the day-to-day things that they would normally do and their overall life goals. In terms of what to look for, it's super important that when we are looking out for this, that we're not only paying attention to what people are telling us, but also paying attention to what might be going on for them, the things that they're not really telling us. It could be things like just noticing whether they're quite tense or feeling quite overwhelmed, holding back from things that they would normally really do. So whether they're avoiding any situations or specific people, becoming just generally a lot more withdrawn is another big thing. We can find things like it really interrupting sleep, so sleep gets a lot more difficult. Muscle tension, or just if they're feeling, reporting to you that they're feeling a lot more nauseous. These are all the bodily stuff that do go on for us. However, they do differ from person to person. But, it is important that we pay attention to what's going on in their body as well. Sometimes you could also see in terms of their behaviors, so not being able to make decisions as easily as they used to, and just being quite startled a lot easier. And in terms of, the other part of when do we know that this warrants further support? When do we know that we should really, support them in seeking some further support from a professional? And I guess there's three really kind of key things that we can look out for. So this involves, looking at how much it's actually impacting them and others around them. So, if you notice that it's really taking away from their quality of life or really interrupting other people around them, so it could be their relationships, that usually is a really good time to think, okay, this is something that we could seek a little bit more support from just along the way, from somebody who can not only kind of explain to us what's going on, but kind of support us in understanding what it is like for us and how and what could be most helpful for us. It kind of can be a little bit about tailoring an individual kind of treatment program for the individual in the context of what their goals really. The other thing is to look out for is whether it persists over time. So, anxiety is something that we all experience at one point or multiple times in our life, and it can be different things that bring it up for us. What to really watch out for is whether this anxiety is, quite, excessive for the situation, and whether this really persists. So it doesn't just go away when, the thing that is causing it goes away. And I would usually look at about like a 2-week time frame. If it's, if you begin to really notice it kind of affecting you past, a couple of weeks, I would really then think, okay, this is something that is, perhaps something that I could seek some support from, because sometimes just the skills that we do have aren't enough, and that's what a professional can help you do, is to try and look at some tools and some skills that you can use in addition to what you're already doing. And I guess the other thing to really look out for is how much, it's coming up for you in different situations. So if it's coming up multiple times across different contexts and situations, that's often a good indication that perhaps this is something a little bit more, and that it could be something that we could talk to somebody about. So I would really kind of look out again for those things. So not only what they're saying, but what might be going on for them, what they're not saying. Pay attention to their behaviors. Look at whether they're avoiding or become a lot more withdrawn. Look at whether it's persisted in time. And also look at whether it's happening multiple times across different places and like contexts and situations. I hope that is helpful as a starter. To help somebody in your life seek some further support. Thank you.